Okay, this is for an ABG stick. You can ask their patient which is their non-dominant hand, and if that ends up being the best site, then you can use that. The radial is where we want to go. You want to stick where you feel the pulse the most. So whatever hand is going to be most successful, that's the one you want to choose. So I'm going to palpate, and I feel it, and then we'll do the Allen's test just to say that we did. So go ahead and relax. So you want to occlude both arteries, the ulnar and the radial, and go ahead and pump your fist. So we're going to blanch the hand, and go ahead and open it up, and then we're going to remove the ulnar side because we're pretending that we caused damage to the radial. So you can see his hand immediately turned pink, which is good. He has collateral circulation, and so that is another reason that we use the radial arteries, because it has collateral circulation. That and the radial pulse is the most superficial of the locations to stick. It does help to put a towel under the wrist, because then it will it'll expose or stretch out the wrist so that you can palpate the artery easier. I'm going to take my gloves off just so I can point some things out. So you would be doing this with gloves. Where you want to stick is the wrist fold. So everyone has a wrist fold. So if you just bring your wrist up, tell me when you can see.
Right there.
This fold here is your wrist fold. Let's see. Actually, this one right here, the second one, this is your palm, and then this is the wrist fold. So anywhere a little bit, toward the elbow, is where you want to stick. When you start getting up here, the artery gets deeper. So you want to, as you can see, the fold is right here. This is where you want to stick, ideally. When you start to get up here, then you get into some bony structures, which is not ideal. So to be successful is to get you and your patient in a good position. So you can see it's not very natural to have your arm in this position. So it's hard. Most patients tend to be like this, and they're unable to flatten their forearm and give you a nice plane for the stick. So and then you want to be to the side to where you're able to stick, and that you're sort of in a riding position. So this is a good position. My palm is going to be in his palm, and that's going to be stabilizing my needle hand. So now I can go ahead and get set up. Can you see? Okay. I have a biohazard bag that the sample is going to go into. And so that's there. The syringe, you want to tighten the needle cap on, and then just out of habit I always plunge it in and pull back to about 1.5 mLs. You can surely get by with 0.5 ml, but to be safe you want to grab a little bit more. So you do want to have a good working space. This is where I'm going to place my needle when I'm done so that I don't stick anyone. This is to remove any air that's left in the syringe. And I have an alcohol swab. That's one we use to prep the skin. And my 2x2 is what I'm going to use for after the stick, when I hold pressure. There is a patient label at both of the hospitals. A label is printed out. So it does have some of the same information on here. Really the most important things to go on the label is the date, the time, and the oxygen in the delivery device. So if they're on a 50% ventilator, then that's what you would put. It would be nice to have the settings as well. And then you have a Band-Aid or a piece of tape for after. Sometimes it's nice to have that prepped and ready to go as well. So again, you would have gloves on, but for this demonstration I'm not going to wear gloves. You're going to prep the site. You're going to palpate for the pulse. And as you're doing the stick, your finger never leaves the site. Can you see it? You have to move. Maybe if you come just behind me.
Can I just take it off?
And just go. And this twist that way. There you go.
Yep.
And I'll get the other arm too. Anyway, okay, so I've taken the alcohol out. In order to prep the site, you want to start on the inside and circle your way out and just do it about 2 times, and that's it. If you do this, scrape, 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 you're going to actually move bacteria in that area. So again, start in the center and wipe out, and then you want to let it dry, because if you were to stick with wet alcohol on the skin, it would burn. Some people will wipe their fingertip with alcohol on their gloved hand where they're palpating. That is also okay. When you're ready to do the stick, you're going to pull the needle top off, and then you're going to hold it in your hand like a pencil. The book does say 45-degree angle. You are more or less closer to being up and down. 45 is about here. You're going to be up a little bit more. And so I'll go ahead and bring the other arm in, and then I'll do the stick. And the main thing I want to show you is the redirection. So if we bring our arm in here, I've prepped the site, I've palpated the pulse. The way that I do it is that I will feel the pulse on the very tip of my finger, and then I will roll back to where it disappears. So I'll feel it here, and then I'll roll back, and if I still feel it, I'll move over this way, and I'll roll up, and then if I feel it on the very tip, then I'll just roll back, and I'll stick right to the side of it. Other therapists will be able to feel the pulse in any part of their fingertip, and they'll know where that is. My fingertips are calloused, so it's hard for me to do it the other way. But some people stick on the side of their finger, and some people stick in front. You just cannot move your finger when you poke the patient. So I'm going to do a 1 swipe. Then I'm going to let that dry. I'm going to pull my needle off. I'm going to have my 2x2 gauze ready. Then I'm going to place my hand in the patient's hand. I'm going to have the bevel up. I'm going to be palpating the pulse. Again, I'll roll it up and feel it and roll back. If it's still on my finger, I'll move over a little bit. I'll roll up, and then I'll roll back. And then I'm going to stick. Am I in the way?
No.
When you stick, your fingertip is there, and you'll push the needle in a nice smooth form. If it starts self-filling with blood, then you were there. You can just stop and let it self-fill. If you need to redirect, I'm going to move my fingertip so you can see this. If I need to redirect, you're going to pull out in the exact same direction that you pulled in. So you don't want to pull out this way or pull out like this. You want to pull out in the same angle that you went in. Then you need to see the tip of the needle come out to where just the very sharp, and you can see the bevel, so the very sharp part of the needle is in. most of the time when you miss just to the left or just to the right. So your redirection is going to be fairly drastic. And so you would be palpating to see which direction you needed to go. And you're either going to swing the needle far this way and stick, I wish I had a pen, you're going to stick here if it's on this side, or you're going to bring it out to the bevel and swing it this way and stick in that direction. Again, your finger is always on the patient's radial pulse. So this is just to show you that a redirection, you usually just miss it, so you're right on the side of it. So if you stick here and you miss, you're going to pull back to the bevel, you're going to redirect, and then you're going to stick, and then hopefully with one redirection you'll get it. I wouldn't redirect more than 2 times after the initial stick. So sometimes you get blood with that much of the needle in. Sometimes the whole needle goes in, depending on the thickness of the wrist. So after you're done, you're going to grab your gauze. You're going to remove the needle, and as soon as you remove the needle, you need to apply pressure. You don't want to apply pressure while you're removing the needle. It's as you remove the needle, you apply pressure. You hold that for at least 5 minutes, and then with your sharps, you can stick it right into the holder. That holder will not allow the needle to come back out. You can't pull it out. So that is how safety measure. It does have a device that goes over the hub of the needle, and then you can twist it off. And then you're going to discard that in the sharps. My blood sample's here. There's a little bit of air up top. You can put this cap on, and it does push. You can twist it, but it does just push on. And then I will tap it to have any air bubbles that are at the bottom come up to the top. After you stick, you want to just make sure that the syringe stays upright. If it's bouncing around or doing all of this, there's a chance that air bubbles can get into the sample. And that's something that you want to avoid. So after you have it in there, you can go ahead and push all of the air out. The idea of this is that air will escape through the top of this device, and then when blood goes onto this cotton, the white cotton piece, then the blood will occlude that, and it'll be an airtight sample. So the label would go onto this, and it would be sent down to the lab. Again, it would have the patient's name, the date, the time, where you stuck. So in this case, it would be the left radial. And then temperature does play a role in blood gases, but most of the time it is not documented. Then you would also have what type of device that they were on. Nasal cannula, venturi mask, BiPAP, and then FiO2. After you've held pressure, you're going to apply the Band-Aid. You want to make sure that when you apply this, some people use compression tape, where it's real flexible, that you do not go all the way around the wrist, because then you can cut off circulation. So, and truly after you have held pressure for 5 minutes, there should not be, you should not even need the Band-Aid, but you can put that on there, and then say you see him in 4 hours, you could take it off of him. So, other than that, you're going to discard your sharps needle. You're going to throw this in the trash. The label and the syringe goes into the biohazard bag. Essentia has red bags that are stat, so that they know to send the sample, or to run the sample right away. And so this goes into the tubing system and is sent down to run. And the most of it is just doing your house chores, cleaning up. And that is it.